Do you suffer from high blood pressure? 50% chance says you do, because it's the number one cause of death in the United States. It is the number one medicated disease in all of America. Listen, I'm Dr. Ben, founder of Well Health and Chiropractic, and I want to tell you about the solution, the proven method. I've seen over 2,000 people take their blood pressure medication and chuck it in the trash can. No medications, no surgeries. So many people are told that their blood pressure is genetic, or their dad's got high blood pressure, or even maybe that it's a weight issue. Listen, I get it that those are all predisposing factors, but there is a number one thing that is so much more important than all of that, and that is the nerve, because no one is talking about it. So the brainstem and spinal cord controls every organ, cell, tissue in the body. For your heart to beat one time, the message has to go from the brain, down the spinal cord, out the nerve to the heart, right? And that's how your body is designed. The problem is, if we were to cut the nerve to the heart, what happens to you? Well, you die, right? But what if you don't believe that, by the way? It doesn't matter. It turns out you're dead and you're wrong. Right? So rather than cut the nerve, what if we were to pinch the nerve, right? If we were to put a pinch on that nerve, now what happens to the function of your heart? Well, it's not going to function correctly. So what's your blood pressure going to do? It's going to go up. What's your plaque and your cholesterol do? It goes up. Eventually your blood gets thick. The doctor puts in a blood thinner, even though all of those medications are not preventing heart disease. It's the number one cause of death, and in spite of the medications we're taking, heart disease is not getting better in the United States. So what is the real problem here? The problem is this is a chiropractic problem with a chiropractic solution. Right? Some people say, by the way, chiropractor, I never believe in chiropractic. Well, guess what? It's not a belief. Chiropractic is simply a tool. It's a tool to move a vertebra, to unpinch a nerve. Let me explain to you how it works. The way that these nerves get pinched, and that I see in my practice, which I've seen again, 2,000 people take their blood pressure medication, chuck them in the trash, is the number one thing that we see is people with whiplash have blood pressure issues. Again, that's anybody who's ever had sports injuries, wrecked their bike, car accidents. If you've ever had a car accident, you definitely have whiplash. Maybe you're sitting over a computer like this all day long. What happens is this is your vertebra, this is your spine from the side. It's supposed to have this nice normal curve, and your spinal cord runs back here. Okay? Well, when you have a whiplash, your neck gets very straight, and what happens is we wind up pinching these nerves in the lower part of the neck. Now, those are the nerves down here that go to the heart. And when these nerves get pinched, right, it's going to cause blood pressure issues. Okay? So the problem here is that the nerve is pinched. The solution is that we need to move the vertebra to unpinch the nerve, but it's just not that simple. Because when you have a whiplash, you wind up damaging that ligament. Okay? You damage the ligament and you wind up pinching the nerve going to the heart. So what we have to do is not only adjust your vertebra, but we have to work on the muscles, ligaments, and tendons to get that vertebra to stay in the right position. Only when you can get it to stay will you see the blood pressure change.